and welcome to the session on building resilient leaders to navigate immunization challenges. We have some eminent speakers today, and we have Eric Martin, who is the Managing Director at Adaptive Change Advisors, the ACA, and he's also an author of Your Leadership Moment. And in case you want to read the book, please grab it and go and buy it. So over to you, Eric. It's a pleasure to have you all here. And some of our scholar alumni, and Eric is going to introduce everyone and talk about how the session will go. But before I move, so there are some ground rules. So the first thing you all should do is type in the chat box, and as you see on the left side of the screen, and of course you need to type which city or country you're connecting from, and please just use the chat window in the sessions panel. Then we encourage you to participate very actively, and please do ask your questions and comments, and we'll be helping you out, and we'll be reading them out for the speakers. And do not click on ask to share audio and video unless you are asked or invited by the speakers to join the panel. And what could happen is if you try sharing your audio and video, it could disrupt the panel, and it can cause a little problem. So, and how does a session work? Well, what you need to do is, what we are going to be doing is introducing the session, as you can see, talking about adaptive leadership and immunization, and then there will be a panel discussion on adaptive leadership and immunization, a Q&A session, and there would be closing remarks, as you can see on the slide. Next, please. Jacques, thank you. And we have some excellent presenters whom you can see. Sarah Kester from Sabin Vaccine Institute. I've already introduced Eric, and we have No, who's from Adaptive Change Advisors, and also Liz Colway, who's from Sabin Vaccine Institute. So a big, warm welcome to you all. I'm really excited to be part of this session. Thank you. Over to you, Eric.
Well, thank you, Shalini, for the gracious invitation and for bringing us all together here today. So yes, I'm Eric Martin, and I work with Shalini and the team at TGLF, as well as the Boost team, and my colleague, Visita Nolovo, who you'll meet momentarily. And we do work around leadership and change. So I just want to say a little bit about what we think of when we say leadership, because it's one of these ideas that's very misunderstood. And I think that misunderstanding leads to a lot of wasted time and resources, particularly when it comes to immunization and vaccination. So I'm going to say a little bit about that, and then I'll introduce you to Kno, and he will then introduce our panelists today, which are Mutwale Adam, Jude Tuma, and Inda Kumatswati. And they'll say a little bit more about their experience with leadership for immunization. So first of all, let me just kind of backtrack a little bit. We're obviously this past year living in somewhat unprecedented times. And I say somewhat because my colleague Ngo often reminds me that in some parts of the world, this kind of situation is not so unusual as it may be in the West. But it's still somewhat unusual. And, to be honest, while many people say that this changes everything, this COVID situation changes everything, to be honest, I don't really see much in our response to COVID that is actually very new. I feel that it's just an intensification, an acceleration even of existing trends, be it distancing, the digitization and indoorization of recreation and entertainment and social life, even things like tracking and surveillance, I think are not new. So I feel there's an opportunity here, even a year into this epidemic, this pandemic, to make a choice. COVID doesn't force us to make choices. The choice is something we do individually. It is actually a leadership choice. And so I like to think of these choices as leadership moments. In fact, I've come to understand leadership not as a person or a position, but as a moment, And it's the kind of moment that maybe makes your heart leap with hopeful anticipation of what's possible for yourself, for your community, for the world. Or maybe it's some kind of fear of taking that next step, stepping into the unknown. So these are moments that come to us every day. In fact, you have about 5 leadership moments that come to you every day, regardless of where you sit in your organization, top or bottom or outside for that matter. So the question that animates our work here is really, would you recognize a leadership moment when it came your way? And would you know what to do when it did? So, we who engage in these leadership moments, which I think includes certainly our panelists today, and I'm sure many of you, these are moments that, you speak up, you stand up, you ask a tough question, you hold people accountable to something they rather not face. You really make sure that people are hearing something that needs to be heard, an unheard voice, an unheard opportunity. And so our work here is to what we call democratize leadership, which means making leadership tools accessible to everyone. But it's also about the idea that anyone, anywhere can lead consequential change, regardless of their history or their background or their access to political power or financial capital. So I think that's our task here today, is to listen closely for the leadership moment in our own work, within our own communities, so that we can better see it and then seize it when it comes our way. And one of the questions we'll be really wrestling with today is the difference between what we call technical problems and adaptive problems. And let me just say a little bit about what that means. I think it's a really fundamental leadership concept, and it's actually the single biggest leadership mistake that people make. So a technical problem is one that has an easy answer. I shouldn't say easy answer, but it has an answer. It has a known answer. So maybe things around, say, cold chain, right? It's not easy, but we know how to deal with that kind of situation. There's a technical response. There's an expertise. There are maybe authorities we can bring in, people with experience who can really show us how to do these kind of things. They're not easy. They're necessary. They're life-giving, but there's a kind of a known response and a known problem. Whereas with adaptive problems, sometimes the problem is not clear, and therefore the solution isn't clear. For me, the quintessential example of that right now is the idea of vaccine equity. So again, the inequity around access to vaccinations is not a new thing. It's just been intensified now. And unfortunately, intensified by, I think, some of what's happening here in the United States and how the vaccine was produced and bought. But equity is an adaptive problem. There is no easy answer. There is really no known answer. Now, that's not cause for alarm or despair. Rather, it's an invitation into collaboration, into partnership, into exploration, into experimentation, into figuring it out together. Because when it comes to COVID equity and the response in general, we're all in this together. We know that more than ever. So that's an example of an adaptive problem. And the single biggest mistake that people make is they put technical fixes on adaptive problems, right? So we'll say a little bit more about what that means, but I just want to plant that idea. And as you listen to the conversation today, try to think of a challenge that you face or problem perhaps that you face where you've tried the best you can to throw everything you have at it. You've tried your technical fixes. You've applied your know-how, your best practices, your protocols, your expertise or other people's expertise, and the problem still keeps coming back. That might be a flag that you're facing an adaptive challenge, and that might be a flag that there's an opportunity for you to exercise leadership in this moment as well. So we'll say more about that later on. I just wanted to kind of give you that small idea. And what I'd like to do now, if I can see, let me just see if Noel is on the call. I know he's been having blackout issues where he is in, I believe, in Mozambique or maybe in Joburg right now. I see you on the call, so let me just turn it over to you and see if you can pick it up and also introduce our illustrious panelists who I'm so excited to spend time with again today.
Wonderful. Thank you, Eric, and thank you for that kind introduction. It's really, I think, an opportune time to be having this conversation, and welcome to all 73 people who are on this webinar, and we'll be speaking directly to you with our illustrious panel. What I'll do is I'll ask them to introduce themselves. we have Inda, who's in Indonesia. I think Inda is in Jakarta at the moment. And Mutali, who's in Sudan, in the northern part of Sudan, where he works for UNICEF. And I think we have Jude. I don't see Jude, but he might be having technical issues. Jude is also in West Africa somewhere. So let me start with introductions and ask Inda to introduce herself. Inda, for the people that don't know you, can you say a bit about who you are, where you work, and what role you occupy in the immunization and vaccination space?
Thank you, Engo. So good morning, good afternoon, and good evening, everyone. My name is Indah Kusumawati, and I'm the Supply Chain Vaccine Management Program Officer in CHAI. I'm from Jakarta, Indonesia. Thank you, Engo.
I'm sure we'll be using some acronyms that people don't know. CHAI, for the people that might not understand what CHAI is the Clinton Health Institute, correct, Inda? That's right. And we'll be talking a bit about access to health and some of those issues that Eric made mention of. Thank you, Inda. Mutwali, let me move to you. Can you introduce yourself and say a bit about the work that you do in Sudan?
Yeah, hello, all of you. I'm very delighted to be with you. I'm Mutwali Adam from Sudan, working with UNICEF Sudan in the Mazin Zonal Office. We are covering 3 states, health officer, like covering all the health system, including the immunization. I'm originally from Darfur region. It's very famous. Thank you.
Yes, Darfur, as Mutali says, is famous for good things also. Maybe people might only know Darfur for, the conflict in Sudan, but, if you're African like I am, there's a lot that's happened in Sudan that's positive, that we look to. So without further ado, I want to jump straight into this conversation with Inda and Mutali around building resilient immunization leaders. And like Eric said at the top of the call, the definition of leadership is really for us in terms of adaptive leadership, less about the who, the people, and more about choices and moments. So I want to talk to Inda first about her experience, not only in Asia, but also Inda has worked in Africa, in places that are quite remote. So when we talk about vaccine equity and we talk about hesitancy, the things that we're seeing now, Inda, in terms of misinformation, can you talk to us a bit about what you see in Indonesia and historically how you've approached, addressing issues of misinformation, some of the strategies you've used on the ground and in the field?
Okay, Engo, thank you. I think when we talk about the immunization program, there must be some challenges need to be approached and solved. It's not only about the availability, but also about how to gain the commitment of the stakeholders to ensure that all the target groups can get their rights to get vaccinated. One of the tricky issues is the vaccine hesitancy, the hoax, fake information regarding the vaccination, and lack of the understanding of the importance of the vaccine. I have used the combination of the various strategies to deal with the vaccine hesitancy in the various districts in a very democratic way, which substantially improve the willingness of the people to be vaccinated. This can be referred to as democratization of the vaccine, as we convince the community to take the vaccine instead of enforcing it as a mandatory policy. because sometimes the community thinks the vaccine is like a force to them to take. So dialogue with the target community to convince them of its benefit was very important. We include the involvement of the local government leaders, the religious leaders, the community leaders by doing the advocacy, and then involving them also after that to conduct the socialization, to mobilize the community. To vaccination the infant, we directly spoke and consulted the parents. Not only the parents, sometimes also the caregivers. We follow them by a hand-holding and mentoring approach by educating them of the benefit of the particular vaccine and the dangers of not taking them. Like as usually I usually explain to them is like the key of C is the communication, the contribution, the commitment, and also the cooperation and collaboration. So we engaged and motivated the wide range of the partner and stakeholders to raise awareness of the benefit of the vaccine by the face-to-face dialogue and to get trust and to build the confidence from both sides. So it's not only from the one side. But to always possible to eliminate vaccine hesitancy in the total, it is really impossible. So, however, we can build public confidence in the government, as well as the community leaders, that immunization program is the best thing for them and for their children to provide education and information. So this is one of the way that I usually do.
Thank you for that narrative that you've just given us, Inda, and I'm very aware that you are on the front line right now. I think I was watching the news, was it yesterday, where they were talking about a milestone that Indonesia has just crossed. I think you've hit the 1 million mark of infections, and this is a very real thing. I know for the work of immunization and vaccination, being that you're already administering the vaccine in Indonesia. So it's important to be hearing about the involvement of government and other stakeholders that are in this space. And I just want to bring in Mutali here. I know this issue of collaboration and partnerships is really dear to Mutali's heart with the work that it does in Sudan. Mutali, can you talk to us a bit about the importance of community engagement and collaboration in the immunization space, and how you've seen that play out in your own region?
Yeah, thank you very much for the chat. Actually, we are like dealing with immunization before this training of leadership. Like we are tackling it as technical issues. Like we brought all the resources, like we brought refrigerator, fridge. We brought the funding, everything. Like we have had the performance in very low indicators. When we attend this training, the issue growing big. Like now with COVID, we had also our indices drop out, all the accomplishment, we lose it, and then finally we hit by the outbreak of type 2 polio outbreak in Sudan. Also, that need us to adapt to this situation, like to keep the situation of there's some background noise, I think, like to keep moving to achieve the target, and then to have had to keep the precaution of the COVID. That also, we had parallelly, we had the flooding and some natural disasters like this. They always accumulating and become bigger problems. Like We saw differently. We approach different entities. Like we saw them, we observed them at the beginning. They have their own initiative, and then we engage them in our consistential action to bring back our effort and also to engage the community at different levels. Then we move forward. Now we have second round, achieve like more than more than 100% the first round of polio campaign, in spite of all the difficulties, the plague and others and these things. This could not be achieved without the taking different approach, adapting to the situation, like be very flexible, using different approaches, and engaging this. And this is one of my since I grew up, I had obsessed with how my father taught me and how to be collaborative with your brothers and how to get involved. And then before graduation, also we had this problem of conflict, and also how I have to return back from the medical school to engage in some benefiting communities. Thus, it has been like experience plus organizing and evidence-based. This adaptive leadership training, it just came in time. Yes.
Thank you, Mutali, and that's a great segue to you've made mention of technical aspects of some of the problems that you face and some adaptive aspects. And here, I'm sure some people are not well versed with some of this language that we're using of technical and adaptive, and it comes from the course adaptive leadership that we've Mutali and Inda, Eric and I see Shalini have been part of, which is something that the Boost community is providing through the Geneva Learning Foundation. And so I want to talk a bit about the learnings from that course with Inda and Mutali to kind of wrap the conversation up and then open up for questions from the audience. I'd like to start with Inda. And Inda, how has your experience, or rather this mindset shift to thinking about problems as technical and adaptive, how has that mindset shift helped you in thinking about and applying solutions to the situation that you find yourself in the practical day-to-day work that you do? How has your leadership experience changed?
Thank you, Enko. So from here, I can learn from others' experiences, because here we also learn from other countries, not only from the same countries. I think in the immunization program, the problem is quite similar. Sometimes it's also like the classic, the classic problem, which is almost similar. So from this, I can learn, and I can also to implement it in my working environment. But the most important that I also can to motivate the others. For example, if I come to the health centers and then they have the problem, sometimes they don't have the the confidence how to deal with the community, even though they live in the same community. So when I go to the district and then I ask them to do the friendly way to communicate with their own community, for example, like that. So it gives me a lot of experience and knowledge.
Great.
And
Thank you, Inda. And Mutali, how are you applying the adaptive leadership toolkit and thinking to the programs that you are doing?
Yeah, it also gives us some sort of relief to how to deal with tough decision, like and also to bring the issues in the surface. Like this technique also, we missed before. We had this way of doing these difficult conversations with the communities, with the partners, and also with the especially some very hard group we need to reach to them. That it consolidate our knowledge, and also our even in the day-to-day work. Also, you need to not just to bring the resources. Also, you need to have some conversation to give them some trust, build trust with your staff, and also you need to give them some safe space to speak out, and also to bring all the issues together, and also to find solution together, and also to put a plan like moving forward how to deal with it. More importantly, also to keep the sustainability on the track, and also on your mindset. If you bring the ownership to the community, you will move forward, and then you let them to continue that. That's what we learn from it. And also we apply it to our personal life, so how to make it different. Like we face a lot of problems how to deal with my newborn rebel. Also how to apply this. Not only this for the work, but also for life also. Very helpful. Thank you.
Yeah. So what I hear both of you saying is that really this way of thinking is not only applicable to the day-to-day work that we do as we engage with other people and do the work of leadership, which is really about mobilizing other people in order to achieve change, but it's also applicable to day-to-day life. And now I want to shift the conversation a bit. We've got I think 5 or 10 minutes to interact with the audience. I want to ask the people on this call if they have any questions for our panel, Mutwali and Inda, or even some reflections or thoughts about what you're hearing. I'd like to invite you into the conversation. I don't have a clear picture of the chat, so I'll invite Liz or Shalini to pick up the questions on the chat and vocalize them and do a voiceover here so we can respond to them. Are there any questions in the chat box from our audience?
There were some questions, like Sohini asked, would you share your experience on social listening as a way to tackle? So Eric said that he would like to hear more about it because he wants to know what this technique is about. And also, you know what we can do, Eric and Liz and Sarah, we can invite 1 or 2 panelists because we have the ability to do so today. So if you would like to invite anyone, or anyone would like to speak up, so we can do that. And I'm keeping an eye out on the questions. So there was a comment again from Sohini. She said, Eric, I look forward to hearing on the 3 very common things: values, loyalties, losses. Then Ahmed Shafiq, he says, it would be great if someone can refer to a good reading regarding leadership toolkit pertinent to immunization programs. Then
okay, let's start with those 2, Shalini, and then we'll circle back to more questions if they are. I believe the one is for Eric. Values, loyalties, and losses. What are those, Eric? What are you talking about?
Yeah, I'll be very brief in that because we have a whole course, of course, that gets into the details. But there was a comment in the chat box about mobilizing people and some of the mindset barriers that people experience to the information that's being provided to them. You know, it's a very technical thing to tell people You know, I know you don't know. Let me tell you. And once you know what I know, you will act in the way that I think you should. That's kind of the assumption behind telling people. And that maybe works, you know, maybe it works half the time or 70% of the time. And it's not necessarily a bad thing. You know, lack of information is a very real problem. The question is, you know, once people hear information, do they internalize it? Do they take it on? Do they act differently based on it? Does behavior change? And if it's not, or if it's not sufficiently changing, then we have to say, well, is there an adaptive challenge here? And when it comes to this mindset barrier that was mentioned, you know, there's three things. First of all, is what do people value? You know, so value means things like, you know, people value the convenience of, you know, having access to a certain kind of service. People value not wanting to wait in line for a long time, or waiting in line and then not actually being able to receive a vaccination. You know, there's time, resources that are values as well. And so we need to understand what are the competing priorities, the choices that people have to make in order to prioritize, you know, behavior that we might want them to prioritize. The second thing is loyalty. What are they loyal to? And I'm sure we've all heard stories or experienced ourselves. Maybe we want to do something, but our spouse doesn't want to do it, or our parent doesn't want us to do that. So these loyalties are very real. And in fact, the more we just give people information, sometimes the more stress and strain we put on those loyalties, because, you know, relationships like that are not just in our head. They're below our neck. They're in our heart. They're in our gut. They're in our soul. And adaptive work happens below the neck, not above the neck. And then lastly, is our losses at risk. You know, what would people have to give up, or what do they fear they'd have to give up if they were to embrace this new behavior? So again, there's more to say about that, but these values, loyalties, and losses at risk tend to be the kinds of things that get in the way of behavioral change. So, you know, one other comment here was on the social listening. I did look it up just briefly. Thank you, Kevin. And it does appear to be a very technical approach, you know, listening to social media. And that doesn't mean at all to say that it's not effective. Maybe it's quite effective. But again, it's the same question, you know, is who's acting on that data? How does that get internalized and integrated into people's daily lives? And that's really what we're here to talk about.
I think, Eric, what you're also saying is there's more detail behind those values, loyalties, and losses, the thinking behind that. And that's really, we delve into that in the course. So for folks who are interested, we can speak about that, you know, on the Boost platform if you're interested. I see more questions around technical and adaptive. What is the difference? Asks who asked that question? Fred asked that question. Yeah, let me throw that question to Mutali. I see Mutali is still there. Mutali, in your experience, you've spoken about things like cold chain. You've spoken about things like relationships. Can you explain to us, using this frame, what the difference between technical and adaptive leadership is?
Yeah, in my case, like for example, like we are like dealing with technical, like when we brought those when we have high dropout, we have the hesitance. We face with all these problems. We usually we approach it. In the past, we approach it like, let us bring more resources, like bring more teams, like bring more refrigerators, like we need to make like geographical distance. It never solves the problem. And also when we came to engage the communities, like we let some of them in silos, like the communities, they are working in different approach, and the staff, they are like in different sense. When we had those issues, we put the pieces together, like when we brought all of them together, the communities and the staff, what's the problem? We understand where their like values and loyalties and these things, what we lose if they collaborate together. This is one of the adaptive, when we need to change these behaviors of hesitancies and those. And also we had also behavior in our staff, like they will lose some of their autonomy if we brought the community in. Like we need to understand more on what's the real issue behind the issue, this of the adaptive, mainly on testing the things and not them sustainability on it. Yeah.
Thank you, Mutwali. And I hear Mutwali saying, for technical problems like, say, cold chain, you really have some technical solutions around. You provide a fridge at a certain temperature, and you keep your vaccines safe and they're usable. That's a technical problem. There's a technical fix. But when you come to issues around relationships, and Mutwali is speaking about the agency of people that you're dealing with that are vaccinating or not vaccinating their children, that's an adaptive issue. No one is an expert in solving that. So you have to engage people in a different kind of way in order to arrive at a solution. So thank you, Mutwali, for that reflection. I think we have time for one more question from the chat box. I see a lot of chatter there. Shalini, is there a question that our panel can?
Yes, there is. It's from Puran Sharma, who says resilience and adaptive leadership has become more relevant with COVID-19 pandemic, which has seen science take the backseat by medical personnel, and it's being overtaken on community technical issues by politicians and bureaucrats. What is the way forward?
Okay, I heard bits of that, Shalini. So Eric, did you get the whole question? My connection is a bit weird.
I did. Now I'm going to combine that also with the question that we heard from Ahmed, who asked about, is leadership kind of a state level question where policy is made and then kind of pushed down? And so these are similar questions. And, the other big mistake that we often make when it comes to leadership, the first one is the technical and adaptive, as I mentioned. But the other one is that we confuse or we conflate the idea of leadership with the idea of authority. So authority is hierarchy. Authority are the people that have the big titles, the big jobs, often a lot of resources. And we often, give these people all of our attention. And we look to them for the answers. We blame them. They just get so much of our attention. And at the end of the day, your attention is your most valuable resource. So you give them all of your resources, and then you think that they are the resource, right? And then they disappoint you, and you say, "Gosh, what can we do?" Now, of course, people in authority have a lot of power. I don't take that away. But if the only way that we know how to navigate change is to convince the people in power to give it to us, well, I don't know what your experience has been, but that doesn't usually go very well. And so we need to understand the pressures that people in authority face as they manage the status quo, and that's a whole different conversation. But we also need to help people see the leadership moments in their own daily work. So, there's a lot of nuances in terms of how policy gets interpreted. For example, I'm doing a lot of work right now in the United States on our COVID response with the US government. And we've given billions and billions of dollars. In fact, I just had a call this morning. They're going to give $20 billion more dollars for the COVID relief. And, the way vaccines are distributed in the United States already is inequitable. And what I said to them is, we don't want to double inequity when we double the funding. So how do we actually get to more equitable vaccine distribution here? Well, it's not just about making a policy. You can't treat it as a technical policy making thing. The policy lays the framework, but how that gets interpreted by these different bureaus has a lot to do with the quality of their relationship and understanding of the communities, which they often don't have to deal with because they're just pumping money into them. So, getting them to shift their behavior to look at what do the communities need? What are they asking for? Do the communities even know what they need? Maybe they're just saying, give us more money. And then that gets used and wasted in different ways. So the real engagement has to happen at that level on the ground. And that requires leadership at every level of the system, not just the people at the top. In fact, the last place we'll get that kind of leadership is from people at the top. It's just not going to happen. So again, I understand that they have power. We need to acknowledge that. But we shouldn't acknowledge that at the expense of giving up our own sense of agency, which is what I think is so powerful about what Mutwale and Inda and others have shared in their experience. So, yeah.
Thank you for that reflection, Eric, and it makes it very real, and very practical. So I see we're racing against time. So I just want to take this opportunity to thank our panel, Inda and Mutali. Maybe if you can put your videos on again. We'd just like to thank you and acknowledge you and the work that you do. It's not easy, and it's really a tough time for immunization and vaccination professionals. So thank you for making time to talk to us and sharing your insights. And I look forward to some of those conversations on the Boost platform and on the Geneva Learning Foundation platform going forward. And that's a great segue to invite someone from the Boost network, either Sarah or Liz, to close this out for us. Moving from here, this is not a conversation that we can finish up. Yeah, Mutali, go ahead.
And I come one word just to quote Helen Keller: "Alone we can do so little. Together we can do so much." Thank you.
Helen Keller. That's a lovely way to end it, Mutali. Together we can do more. And in Africa, we say, if you want to move fast, you can move alone. But if you want to go far, you have to move together, right? So just echoing what Mutali is saying. Let me invite Liz to say a bit about the Boost platform, and we can have that conversation on that platform. There's not enough time for us to exhaust all the issues that we need to talk about. So Liz, where can we meet? Where can this group of people meet and debate and discuss these issues?
Thanks so much, Nok. And I also just want to ditto our thanks to Mutwale and Inda for joining us. I've been providing some links throughout the conversation. So like Nok said, we'll be continuing this conversation on the Boost Community platform, which is just boostcommunity.org. So if you're not already a member, I do encourage you to sign up. It's free to join, and you'll have access to all the conversations and trainings that we discussed today and hope to continue. I also provided a few other links. One is just to our Voices of Leadership series, which both Mutwale and Inda have participated in. So they've had a longer conversation with Nok just about their leadership journeys. So I would encourage you to check that out. I added that in the link and can share it afterwards as well. And then we also have an upcoming course, which actually combines some of these concepts of adaptive leadership that were introduced today, and also combines it with community organizing, which is another topic of focus for the Boost community. So registration for that course actually ends today, but it starts early February. So if you want to learn more and have more conversations with Eric and Nok, I encourage you to sign up. And yeah, just thanks everyone for your participation today. I really appreciate it. It's been a great conference so far.
Wonderful. Thank you, Liz. Let me give Shalini the last word, since for being such a great host on the Geneva Learning Foundation platform.
So thank you so very much for this wonderful session, and I can still see so many people typing in and thanking you all for a great discussion. And it's always a pleasure to have you all here. And if you want to know more, please do join the Boost community. You can have a chat there as well, and you will get as well. So have a very great day, and there are some more Sabin Vaccine Institute sessions if you want to join. So do refer to the schedule. And thank you very much, Eric, Nok, Elizabeth, Sarah, Inda, and Mutwale. It's been great having you here. So with that, I would like to ask Nov to close the session. As I always do.
It's a ping pong. Shalini and I have this game that we play, who closes. So thanks to every one of you. I see the numbers are still going up. At the top of the call, we had about 600 and something people. And now we've only got 600. And we don't take that for granted. Thank you for making time to attend this webinar, this conversation. And I look forward to interacting with some of you on these platforms that Liz and Shalini have made mention of. Have a wonderful day and stay safe wherever you are. Thank you so much, everybody.
Thank you.
Thank you.
Bye.